Hi guys, just thought I'd make a quick video regarding the cultural factors affecting access to healthcare services. So, what is culture? Well, culture is the variety of factors that encompass the social characteristics and knowledge of a group of people, including their language, beliefs, religion, art, cuisines, laws, customs, and social habits. Cultural barriers in health workplaces include any obstacles that a person may encounter, such as differing medical procedures and practices, languages, or ideas in relation to gender and sexuality. So, factors include language barriers, religious beliefs, values, expectations, cuisines, laws, and customs. So, there's a fair few. Culture in Australia. So we've got several groups and different types of culture. Some include Indigenous Australians, migrants, refugees, and those who don't speak English at home as a first language. These groups are less likely to access healthcare services and information due to the language barriers, not understanding the information that is provided, they may not feel safe, and they may not believe it is culturally appropriate to be participating or being involved with. So some examples are Jehovah's Witness religion. They don't believe in blood transfusions, so therefore they aren't allowed to receive blood donations from others. So this can cause issues and complications during emergencies or surgery. Particular religions may prevent women from consulting with male doctors. Some cultures require women to dress modestly and may make them less likely to want to expose some parts of their body for examination. There are some beliefs amongst religion associated with food and fasting, which may prevent people from being able to access services or staying in hospital due to their food requirements. In some areas, hospitals are not staffed by particular culture groups, meaning medical professionals may lack understanding of culture and concepts of health and well-being. Indigenous Australians. Access to health services and information is an important factor in ensuring health and well-being. Access to health services and impacts the health status of Australian, Aboriginal and Torres Strait Islander people, as they have an overall poorer level of health and greater need for health care compared to non-Indigenous Australians. By identifying where access is particularly poor, this can assist with planning as well as policy decisions relating to health services. Figure 6.6.1 shows areas where Indigenous Australians have poor access to primary health care services by SA2 and location of services in 2012 to 2013 and 2013. Figure 6.6.2 shows age standardised rates of Medicare services claimed per 1,000 people by Indigenous status in 2013 to 2014. Figure 6.6.3 shows the MBS health checks Indigenous Australians by age 2006 to 2007 and then to 2013 to 2014. Statistics. Aboriginal and Torres Strait Islander people are 2 times more likely to go to hospital compared to non-Indigenous Australians, although non-Indigenous Australians are more likely to undergo a procedure while in hospital. Indigenous Australians have longer wait times compared to non-Indigenous Australians for a range of elective surgeries, in particular total hip replacements. Looking forward, it is unacceptable for cultural barriers to hinder health services access for particular groups in Australia. Everyone must aim to reduce or even completely close the gaps in healthcare. More research must be performed to understand the roles of healthcare professionals and nurses in closing this gap. For cultural groups such as Aboriginal Australians and Torres Strait Islanders to fully attain equitable access to healthcare, it is important that we are removing the cultural barriers present. So hopefully that was just a nice quick short video to summarise what cultural barriers and how they affect access to healthcare in Australia. We do have a number of other resources available for you.